The following program is a West Tennessee PBS special presentation made possible through the generous financial support of viewers like you. Please visit westtnpbs.org and make a donation today so that we can continue to make local programs like this possible. Thank you.
This month on Channel 11 Checkup, when a foodborne illness outbreak makes headlines, how do health officials track down the source? We go behind the scenes with an epidemiologist to uncover the science of disease detective work. Plus, as student athletes head back to the field, we'll share what every parent, coach, and athlete should know about recognizing the signs of a concussion. And in recognition of World Breastfeeding Week, we'll talk with WIC specialists about why asking for help can make all the difference for new mothers.
From your health to your kids' health, from senior care to family wellness, from what's on your plate to how you live every day. This is Channel 11 Checkup with Ginger Rowsey from Madison County Health.
Hi, I'm Ginger Rowsey. Thank you for joining us for this edition of Channel 11 Checkup, a show that focuses on the health of our community. In this show, we'll provide education and resources on health and wellness issues facing West Tennesseans. But first, here are some health headlines. Measles cases in the United States have already passed last year's record-setting total. According to the Centers for Disease Control and Prevention, more than 2,300 cases have been confirmed so far this year, a level that hasn't been seen in 35 years. The country is in danger of losing its measles elimination status this fall. Here in Tennessee, 3 measles cases have been reported so far in 2026. Health officials say the best protection against measles is staying up to date on the MMR vaccine, which protects against measles, mumps, and rubella. Most children receive 2 doses as part of the routine childhood immunization schedule, and 2 doses are highly effective at preventing measles. If you're unsure whether you or your child are up to date, check with Madison County Health to review your immunization records. The Centers for Disease Control and Prevention has officially ended its emergency response to a rare hantavirus outbreak linked to a cruise ship in South America. The outbreak sickened 13 people and claimed 3 lives after investigators determined the Andes strain of hantavirus spread from person to person aboard the ship, a rare characteristic of that particular strain. Most hantaviruses found in the United States do not spread between people. Instead, they're typically contracted through contact with infected rodents or their droppings. Health officials say the risk to the general public is now considered extremely low, but the outbreak highlights the importance of disease surveillance and rapid public health response when rare infectious diseases emerge. In other news, cases of gout, once considered a disease that primarily affected older adults, are now being diagnosed more often in younger people, even those in their 20s. Health experts say rising rates of obesity, high blood pressure, diabetes, and diets high in processed foods and sugary drinks are all contributing to the trend. Gout is a painful form of arthritis caused by a buildup of uric acid crystals in the joints, most commonly affecting the big toe, ankle, or foot. While genetics can play a role, many risk factors are lifestyle related. Doctors say maintaining a healthy weight, limiting sugary beverages and alcohol, and eating a balanced diet, as well as managing chronic conditions, can all help lower the risk. Anyone experiencing sudden, severe joint pain should talk with their healthcare provider, as early diagnosis and treatment can help prevent long-term joint damage. And finally, Madison County residents now have a new way to recycle. Glass recycling is officially available at the Oakfield Solid Waste Convenience Center, the first and currently the only convenience center in Madison County offering the service. Accepted items include glass food and beverage containers of any color, drinking glasses, candle jars, and even glass windows or tabletops as long as any frames or hardware have been removed. Items like porcelain, ceramics, mirrors, Pyrex, dishware, light bulbs, televisions, and coffee mugs are not accepted. When dropping off glass at the Oakfield Solid Waste Center, look for the white container marked Approved Glass Only, and if you're ever unsure whether an item can be recycled, ask the solid waste attendant on site. They're happy to help ensure the right materials end up in the recycling container. When we hear about an outbreak of Salmonella, E. coli, or cyclosporiasis, the headlines often focus on the number of people who have become ill. But behind every outbreak is an extensive public health investigation involving science, interviews, surveillance, and collaboration between local, state, and federal agencies. Joining us today is Shanna Wilbanks, Regional Director with Madison County Health, and also an epidemiologist, to explain how these investigations work and why they matter, not just during the outbreak, but all the time. So Shanna, first of all, thanks for being with us.
Thank you.
People hear the term foodborne illness, but that's really kind of an umbrella term. It covers a lot of different diseases or infections.
Yeah. Number one, what I'd love for people to know is where you don't just listen to me, know where you can go for resources. CDC is always great. Our Tennessee Department of Health website's great. Our Madison County Health. But also with something like foodborne illness, remember FDA.
Yes.
They've got I printed it out. They have a great chart, and that's just Google foodborne illness. You can put in FDA, and it brings it right up, and it really answers everything. It doesn't get into the details of some of these are viruses, some are parasites, some are bacteria, but it does give you just kind of general information about what you need to remember about these illnesses.
So what are some of the more common illnesses that we see when it comes to foodborne illness?
Of course, everybody Salmonella,
yes.
E. coli, S-tech, which is the shigatoxin producing E. coli, Listeria. I mean, there's, cyclospora, of course, is not one that anybody would think of except when there's a large
here recently
outbreak.
That we've heard so much about it.
And then this year, yeah. And then some of the ones, hepatitis A is not what some people would think about that you can get from ingesting food that has been handled by an infected worker or whatnot. Listeria, Salmonella, Shigella is one that comes and goes in waves. Staphylococcus aureus, Vibrio, and those are some that come in like raw seafood, undercooked seafood, shellfish, things like that. So
you've, as an epidemiologist, you've been working with this for many years. So kind of walk us through the process. If someone is sick, they think they have a foodborne illness, I mean, what happens? What do they need to do? What's the role of the health department?
Yeah. A lot of times we do more passive surveillance.
Okay.
So, but outbreaks can also be active too. So we have a combination of passive and active. But usually what we get, the first thing we'll get is a positive lab, and that begins the investigation process. Each one of these cases, each lab we do investigations on, okay? So you don't really hear about outbreaks until they get larger scale.
Right.
Mainly, usually. But we would start with a positive lab, call, interview that person, just see if food has anything to do. Have they been out to eat? Have they eaten at home? Do they have their own garden? I mean, so figuring out where their sources are of their food is number one, of course. And then there's also an online portal. So you can go to the Tennessee Department of Health website, tn.gov, you can search and go that way and be able to do kind of a paper interview online. And that way you can put in, was your entire party sick? Was it just you? Was it, and that way that goes to Nashville and it's easier to track similar complaints.
Yeah.
And that will come down to our regional level.
So someone goes to the doctor, they get that lab that comes to you. So you see that someone has one of these foodborne illnesses. At what point are you like, okay, maybe we have something going on here? Is it, how many cases does it take to really get you thinking?
Riled up.
Yeah.
Usually more than a couple. And by couple, I mean, if you and your husband, Ginger, were out to eat, we wouldn't worry as much if both of you got sick because you live in the same household.
Sure.
But if you and 5 other of your friends went out for a girls' night, and the one thing you have in common is that restaurant you ate at.
Okay.
And you may have all eaten the same food that night. And that's where kind of bells start going off with us. It's like, wait a minute. But then again, we've had groups of friends that one person's kid was sick and she got norovirus from her daughter and she shared the same margarita that everybody had, and you can spread that way too.
Sure. And of course, norovirus is not a foodborne illness, right?
It can be. It just most of the time, though, it is so easily spread person to person that's how it usually gets passed.
I gotcha. Okay. So when you're so at that point, it maybe becomes an investigation when you're seeing all these other cases. Now, something I've heard you say too, and and I think probably this is just human nature, but people tend to blame the last thing they ate before they got
Absolutely.
sick. I got sick after
Absolutely.
supper, so it must have been supper, but when in actuality, it could have been yesterday's breakfast.
Right. There's only a handful, and by handful I mean 1 or 2, that are actually within an hour to 2 hours after you ingest either that parasite, bacteria, whatever,
Okay.
that it actually takes effect. Most of them are 6 to 8, 12 a day on up to, 30 plus days for hepatitis A.
Wow.
But usually people that are sick have already had a couple meals under their belt,
Okay.
and so we really try to find those cues and those things that we can that trigger people's minds of what were you doing on this day? Did y'all go out to eat? Did you do this? Look back through your receipts, and that's if they're willing to help us. And that really is what we're trying to do, is just make sure there's not a common source or, where we can pinpoint one thing that is in common with everybody that we could stop.
Because I know that the cyclosporiasis that's been in the news recently can be in your system up to 2 weeks before you start having symptoms. So,
Yeah.
I mean, can people really remember what they ate for the past 2 weeks?
Most can't. I can't. I used to be able to. I can't. I mean, I don't think the average person can. And that's why these outbreaks go on for as long as they do sometimes, because you can't ever really finger and pinpoint what that common source is.
Yeah, I'm sure that
So,
does make it really tricky to investigate. And that does also bring up, because I think a lot of people will assume things. They hear other people got sick from something. They're ready to identify a source, and they want those answers. We get that, but you're also balancing giving people answers, things to avoid, but also you want to finish the investigation. I mean,
Right.
how soon, or I guess at what point do you feel ready to put out, hey, this is the source, we know what it is, don't eat this?
Yeah, there's a lot of factors that go into that. Of course, nowadays, there's so much word of mouth, and there's so many, a lot of times other people hear things before we do, but with nationwide outbreaks, you're really waiting on all the data, and you're waiting on all the analysis, and you're waiting on enough cases to really feel like you can finger and pinpoint what everybody had in common.
Yes.
Because nowadays it's, you don't want to hurt anybody's business, but you also want to be responsible
Right.
about trying to help people not get sick and prevent what they can, and just give some general overall great health advice. So it's tricky.
Yeah.
It's hard.
So if there was just some general overall health advice when it comes to foodborne illness, what would be some of your go-tos?
And it depends on, of course, what you're dealing with. Like with cyclo, it does get in those grooves of the lettuce
Yeah,
and
the wrinkles of the
and
lettuce
the
or the
berries or the
berries, the
cilantro or
crevices.
whatever.
Yes, yeah.
So it's very hard. I'd like to say that I prepare my produce that I buy at home really well, and I rinse my berries, and I do a vinegar wash, and I do sometimes. I have lately, more lately, but it's very hard to even get all of that out. So I want people to realize too, things that happen like this cyclo outbreak, like last year and this year, it really is a bigger problem than just any restaurants that have this food coming in. It's not necessarily that somebody's not washing their hands correctly.
Yes.
Or this is a bigger problem than just the local restaurants or it's a supply chain issue.
Yeah.
And how we are now, we get, we can have produce in Walmart or Kroger or Aldi within a day of when it was picked. I mean, that's from Mexico or from wherever we're getting it. So that's made it a little trickier too.
Yeah. So if there's, I guess, before we go, just one thing that if you would like people to know about foodborne disease investigations that they probably don't.
I guess to me would be, it's such a high percentage of, we never know. Like I think it was 98 or 99%, I can't remember, this was years ago, of those are the cases we don't know where it came from. And it's frustrating, and it's frustrating for the patient too.
Sure.
Because you can't pinpoint, even when everything goes right, and you can get a stool culture, and it's called PFGE, you can fingerprint it too if you have a source of the food that you think is contaminated. Very, very, very rarely are we able to make all the dots connect and go, that was it. That's the smoking gun. That's the source. And also, things change so rapidly, and they evolve so quickly. You can go from a handful of cases to 3 times that
Mhm.
over a weekend
Mhm.
or over a few days, or, you know, and so you have to be patient. And I know it's not easy for us to be patient nowadays because we want information now and we want to have answers,
Mhm.
but you have to really plot things out, map things out, analyze them to see what the true picture is
Mhm.
behind when people got sick, when they went to the doctor, when they got tested, when the positive test came in,
Mhm.
and try to relate things back to each other.
Yeah.
So that would be mine.
So if you do find yourself, unfortunately, a victim of a foodborne illness, and someone with the health department reaches out, what are some things that would be helpful for a consumer to keep in mind to be able to relay back to the epidemiologist or the investigator?
Yeah, just the minute you start feeling sick, I know you're not thinking about except anything except feeling better,
Uh-huh.
but try to kind of think about what did I, you know,
Mhm.
when did this start and where did I go and who else is sick? Be an investigator too.
Mhm.
And that helps us. And don't be scared of us calling. I know everybody got nervous, COVID, and
Uh-huh.
things, but we've been doing this a very long time, way before COVID. And
Mhm.
so we're just trying to identify and make sure nobody else gets sick.
Right, to help the
Um,
investigation along. So the
exactly.
more information you can provide, the
The
better.
better. Mhm.
So that's obviously a really great thing, and I think a lot of people want to see where things can go. So,
Mhm. Yep.
well, thanks, Shannon. We appreciate you being here with
Sure.
us. Thank you so much for being here today.
Thank you.
As a new school year begins, student athletes across West Tennessee are returning to the field or the gym. Along with the excitement of a new season comes an important responsibility: recognizing and responding to concussions. A concussion isn't always obvious, and athletes may not recognize or report the symptoms themselves. Knowing what to look for can make a critical difference in preventing more serious injury. Here's a closer look at the signs and symptoms every coach, parent, and athlete should know.
Knowing the signs and symptoms of concussion can help you decide when to remove an athlete from a practice or competition. Concussion symptoms are what a person is feeling, which means you can't really see them. They occur after a bump, blow, or hit to the head or body. Symptoms might include a headache, feeling nauseated, or feeling dizzy. An athlete might also feel foggy, sluggish, or confused about the game. On the other hand, you can observe concussion signs. These are the things you might actually see when an athlete is experiencing concussion symptoms. For example, you might see an athlete wince when someone shouts near them, or if they squint in the sun, a sign of sensitivity to noise or light. Some signs might appear immediately, while others might take time to be noticed. When an athlete has a concussion, they might appear confused, dazed, or stunned. Look unsure of game, score, or opponent. Move clumsily, appearing off balance or dizzy. Be slow to answer questions. Not be able to remember events before or after the hit, bump, or fall. Lose consciousness. Show behavior or personality changes, like being more emotional or frustrated than usual. Concussions can be hard to spot because most athletes experiencing concussion won't lose consciousness. That only happens in about 10 to 15% of people with a concussion. Some signs and symptoms of concussion can be easy to miss. Keep a close eye on your athletes after any hits, bumps, or blows to the head or body. And remember that you might need to ask athletes about their symptoms directly.
August 1st through 7th is World Breastfeeding Week, a time to recognize the health benefits of breastfeeding and the importance of supporting mothers throughout their breastfeeding journey. While breastfeeding is a natural way to nourish a baby, that doesn't always mean it's easy, and many new mothers experience challenges in the first days and weeks after delivery. Having the right support can make all the difference. Today, we're talking about the benefits of breastfeeding, some of the common obstacles families face, and how WIC's breastfeeding program provides education, encouragement, and practical support to help mothers reach their breastfeeding goals. And joining us today is Andrina Childs, who's a breastfeeding peer counselor with WIC, and then Melissa McPherson, who's the breastfeeding coordinator with WIC. And thank you both for being here.
Thank you for having us.
Melissa, we'll just start with the basics. Why is breastfeeding considered the best way to feed your child?
I think breastfeeding is the best way to feed your child because it's adaptability. When you nurse your baby at the breast, your breast milk actually changes to meet your baby's specific needs. So the nutritional composition can change throughout the day, and it also the antibodies that breast milk produces. So if you're exposed to anything, your baby's exposed to anything, your breast milk is going to give that extra immune support. And that's just something you can't find in formula.
Yeah, it's just the natural way that's just so good for those babies. But we hear the word natural and we all think, okay, natural's best, maybe natural's easy, but Andrina, we know, and I can speak from my own experience, that just because it is natural doesn't mean it doesn't come with challenges. Breastfeeding can be hard.
It definitely can be. I know with my first baby, we had some challenges as far as with latching, some pain, some unfortunately a little bleeding, but we worked together. We practiced and everything. We eventually got it, so it worked out really well in the end.
Are those some of the most common challenges you see with a lot of new moms?
Most of the time we see moms who are having trouble with latching, and we just always recommend the course of waiting for baby's mouth to open wide before bringing them to the breast, and it just helps out a lot with avoiding the pain and helping with the baby getting the most milk out as possible.
Gotcha.
And we like for all of our moms to know that breastfeeding should not hurt. So if it's uncomfortable, you can always relatch, try again, change the position. It should be comfortable for you.
Absolutely, absolutely. So when mothers experience those challenges, though, and they're trying to work it out on their own, I mean, what kind of tends to happen?
Well, they can get overwhelmed or possibly want to give up.
Yes.
So if they're having issues, I hope that they'd reach out for us and ask those questions when they have them.
Yeah, and so if they are having challenges, and they may even be getting some, I don't want to say bad advice, people are trying to be helpful, but hey, just try formula or just do this. Maybe it's not meant to be for you. Is that something that you hear mothers say that people have been telling them?
I would say so.
Yeah, sometimes.
Yes. Unfortunately, we hear a lot of mothers talk about things they see on social media.
Oh, yeah.
Which we always tell them, like, oh, we're on social media. We see the good things and we see the bad things. We definitely want them to focus on the good things and contact us if they are having trouble.
Yeah. So talk a little bit about what it is that you do at WIC specifically to help moms through the breastfeeding journey.
We're definitely a team. So Andrina, as the breastfeeding peer counselor, she's our breastfeeding cheerleader. She's the one that gives that encouragement and support when they need it. She's breastfed all 3 of her children. And then me as the breastfeeding coordinator, I work at WIC as a registered dietitian and, of course, a certified lactation consultant. So I feel I can kind of help with more medical issues the baby might be having, where Andrina's great for the practical assistance they might need.
So how does someone get in the program? Do they need to, is this something they do while they're pregnant still, or can they join at any time? How do we get involved?
Well, we are an income-based supplemental nutrition program, and we're here for pregnant women, infants, and children. So as soon as you find out you're pregnant, you can call us, make an appointment, find out if you're eligible, and then we provide benefits throughout the pregnancy, after delivery, come back and get certified as a postpartum mom, and you can be on after postpartum. But we start talking about breastfeeding during the pregnancy.
Sure. Yeah, that's a big important thing. So, so when people call, do they have to come in? Do you call? How do they reach out to you, or how do they get the education?
Well, like she said, once they get on the program, they'll normally talk to me as a pregnant person. And after the appointment, we go over the benefits and some of the barriers that might be going on. And sometimes it's things that they might have said about something the family members are saying about breastfeeding. So we kind of have to break those myths and everything. Like, oh, no, not that. And I normally give them my contact information then, and they have the ability to contact me via text, email, social media, however they want to get in contact with me, email.
So you're available all the time, basically.
Not all the time.
Not all the time, okay.
But we have a cutoff.
Okay. She's not at your fingertips all the time, but you are very available and always very friendly and a calm, encouraging source for everyone.
If you do need 24/7 assistance, Tennessee does have a free 24/7 breastfeeding hotline. So if we're not available, that's another good resource for our Tennessee residents.
All right, fantastic. I would imagine returning to work is a big concern for a lot of moms. How do y'all advise people to go through when they go through that challenge or that transition?
We talk about what it's going to be like when they go back to work, and I always encourage them to talk to their employer before they even go on maternity leave to see where they're going to have them set up as far as pumping, because Tennessee does have a law, the United States has a law that says that mom can come back and pump, and it can't be a bathroom. So we kind of go over that, and I just make sure to remind them of that.
Yes, that is within their rights to have that
Right,
facility at their
right.
office or place of employment. Melissa, what about some of the best ways? And we talked about some of the myths that you have to bust through, but if there are grandparents watching, spouses, partners, how can they best support the breastfeeding journey? I know my husband said he kind of felt helpless through things, but what can the husbands or grandparents do?
Well, and we do want other family to understand that it is mom's job to feed the baby right now. We want her nursing at the breast to get her milk in and get that supply established. So just start having those conversations with your family and let them know there's other ways that they can help you. It doesn't have to be holding and feeding the baby.
Yes.
They can cook a meal, they can do some laundry, run errands for you, help with older children. So there's other ways without having to feed the baby.
Absolutely. What about for mothers who may not be able to exclusively breastfeed? Do y'all work with them in any way?
Oh, absolutely. Yeah.
Yeah, we do. We definitely have a few moms on the program who decide to do both. You know, we have 3 food packages on WIC, so 2 of them are breastfeeding, one of them has formula on it, and we definitely try our best to support
Sure.
all of them.
Yeah.
And we like for them to know it's okay.
Right.
It's okay if you can't exclusively breastfeed, because every drop counts.
So breastfeeding as much as you can is sort of the goal. But, you know, no one has to be perfect. No one is perfect, of course. So the mom's watching today and she's feeling overwhelmed or unsure whether her breastfeeding journey is going well. What advice would you have to encourage her right now?
Say, you got this.
Yes.
Say, you're a great mom. We just like for moms to know just you even thinking about breastfeeding or trying to breastfeed just means you're already taking those steps to be the best mom you can be.
Yeah, absolutely. And Dorina, what about you?
Just try your best, and if it doesn't work out, you know, we're here for support, and just
Here when you have questions, call us.
Yes,
please.
yes. Before we wrap up, is there a piece of advice you'd like moms to know that before they're a new mom and they've heard about breastfeeding, before they bring their baby home, what would that be?
Andrina knows my favorite tip. We've already talked about it a little bit, but be wary of social media. Just because what you see on there is not necessarily the norm or the expectation. So just know your body is designed to make the amount of breast milk that your baby needs. So your body's designed to feed your baby, not a freezer.
Right.
Pay attention to those videos where the moms have freezers full of milk.
Yeah, that can be a little daunting, but yes, that is great advice, that your body can feed your baby just how he's supposed to be fed. Yeah.
Well, one other thing we like to talk about too, it takes between 3 to 5 days to get your mature milk. You know, you hear a lot of moms talking about, oh, well, my milk didn't come in. You know, they're talking about mature milk. So we like to emphasize that you'll have your colostrum until days 3 through 5, because it's different for everyone.
Sure.
So just keep working at the breast as far as letting them get the colostrum.
Stick with it through the first week. You know, that's probably the toughest part. So, and what about they need to contact WIC? How do they get in touch with you?
Well, they can call us. You can reach us at the WIC Center at 731-423-3020. I do have a direct extension, 2124, or you can reach Andrina at 2114.
Well, Andrina, Melissa, we appreciate you so much for being here and sharing that great information. And thank you both for being here and for what you do for breastfeeding moms. I know you're appreciated. So before we leave, we do want to thank our other guest today, Shanna Wilbanks from Madison County Health, for being here to talk about some important topics. And of course, we'd like to thank you for being here watching this episode of Channel 11 Checkup. We're glad you joined us, and we'll check in next time.
The program you've been watching was made possible through the generous financial support of West Tennessee PBS viewers like you. Please visit westtnpbs.org and make a donation today so that we can continue to make local programs like this possible. Thank you.